zone.
So this patient, for instance, is receiving oxygen, low flow oxygen vehicle, and this patient on the other side is having high flow oxygen therapy. So this patient is not doing well.
That's Dr. Yalom Dikman, who heads the ICU in Istanbul University Cerrahpaşa School of Medicine, one of the country's busiest. He's been an ICU doctor for 3 decades, but nothing compares to this.
It is quite intense at the moment.
No one really knows where this virus is going. I mean, that's got to be a little bit scary at times.
Scary, intellectually challenging. Well, okay, but we have to do something. And we are trying to do our best. But we are having very good results, actually.
Turkey has struck out on its own with its treatment protocol, like delaying intubation and opting for oxygen flow therapies for longer periods of time. Administering favipiravir, the Japanese antiviral, and hydroxychloroquine, the controversial malarial drug, very early on, which many experts say can cause long-term damage that outweighs its unproven benefits. But the team here says they're not worried about that.
We are dealing with a jigsaw puzzle, and we just try to find the correct pieces and put them in correct place, and we just do something and hope for the best.
This patient is in his 40s with no pre-existing conditions.
So the lungs sometimes get very sick and cannot get any oxygen to the blood. And then in order to keep the patient alive, you have to get blood out of the body and oxygenate out of the body.
The patient's oxygenated blood is pumped back into his body.
Everything about being here is just really intense. The machines are constantly going off, wearing this protective gear. And I have to say, these nurses, these doctors, they really have nerves of steel.
The staff is surprisingly upbeat. The hospital is not overwhelmed despite daily jumps in positive cases in the thousands countrywide.
And this area is another intensive care unit. Now it's free, as you've seen. We have plenty of spaces.
Unlike in some areas of the US or Europe, there is no shortage in PPE, bed space, or life-saving medical equipment. Around 70 of the staff have tested positive for COVID-19. Bushanur Chakmak, an emergency room nurse, was among them. This is her first day back on the job. To be honest, I can't say that I'm not afraid. It's stressful, she tells us. But I am more cautious now than I was before. No matter how hard the staff here work, no matter how ready they are for an influx they hope will never happen, they can't beat this pandemic on their own. That is on all of us. Arwa Damon, CNN, Istanbul.